Welcome, and thank you for joining the Donor Week of Talks. My name is Gail Moloney, and I'm going to be presenting on respect, interaction, and immediacy, a proven pathway to registration. Thank you, and welcome. So I'd like to first of all just acknowledge the people who this presentation involves: Michael Sutherland, Lee Upcroft, Ian Walker, and Alison Bowling. I'd like to start off also and tell you where I am from. So I'm based in Coffs Harbour in the discipline of psychology and Faculty of Health at Southern Cross University. We are 4 hours south of Brisbane and approximately 6 hours north of Sydney, by car that is. A few of our beautiful birds down below: pelican, tawny frogmouth, and a galah. I'd also like to acknowledge the wonderful people who have been involved in this research. My collaborators, New South Wales Organ and Tissue Donation Service, with a very special thank you to Danielle Fisher for her ongoing support, and also to Leah Upcroft, who has worked very, very closely with us on this research project. I'd like to acknowledge my research team. I'd especially like to thank Dr. Michael Sutherland and acknowledge his passion for this research, which has been nothing short of inspirational. So the focus of this presentation is going to be on the question of how do we increase the number of people who register their organ donation decision on the Australian Organ Donor Register. Why is this a problem? In Australia's opt-in donation system, people are encouraged to register their donation decision on Australia's National Organ Donor Register. Now, this replaced the driver's licence in 2012 in all states except South Australia. Now, people can register a donation decision as a yes to donate all organs and tissue, yes to specify which organs and tissue to donate, or they can register a no to donation. They are also strongly encouraged to share their donation decision with their family. Why is registration important? In the intensive care unit, the next of kin are always asked to confirm the donation decision or to make the final donation decision if it is unknown. If a person has registered, it facilitates timely national access to their donation decision for medical personnel, who will then discuss this decision with the next of kin. So registration is pivotal to increasing the number of people who donate their organs and tissue. We know that 90 to 93% of families will consent to donation when a consent donation has been registered on the AODR. We also know that this figure drops dramatically when the donation decision is unknown. And this is because the next of kin must make the donation decision themselves. And this can add anguish to a time of grief. And it can lead the next of kin to seek the decision of least discomfort, which is a donation decline. In Australia, most people, if you ask them, will tell you that they support organ donation. They think it's a good thing, it helps people, and it benefits society. But despite extensive marketing campaigns framed to appeal to altruistic ideals, where donation is a good thing to do, civic responsibility, where donation is the right thing to do, or sentimentalism that tells of personal positive stories, registrations on the Australian Organ Donor Register are still low. 34% of people nationally who are eligible to register have registered, 38% in New South Wales. Now, this leaves 66% who have not registered their donation decision. So, how do we increase the number of people who register? What we did was, we drew from some early research that we had conducted. And this research looked at what people understand about organ donation. Now, this suite of studies draws from the theory of social representations. The concept of social representations was developed by Serge Moscovici as a social psychological approach that articulates individual thinking and feeling with collective interaction and communication. It is, in short, a theory about the construction of social knowledge. Social representations are conceived of as symbolic, collectively concerted patterns of thinking that are formed through inter-individual, media, and institutional communication. Representations shape how we interact with others and how we come to understand and make sense of unfamiliar, new, or threatening social issues, particularly those that emanate from the medical, scientific, or technological realms. Now, representations are dynamic, with the propensity to accommodate contradiction, ambiguity, and tension, forming and changing over time through interaction and discourse as new information and ideas enter into the public sphere. Now, this does not exclude or negate individual experience or thought. Rather, it acknowledges that our understandings have their origins in mutual interaction. Representations provide the mutual ground for people to discuss, argue, and negotiate. This does not imply that individuals hold the same views, rather that there is an awareness and an understanding of the common views held by individuals, such that even though an individual may not personally agree with one or the other view, they can easily engage in discussion involving one or the other viewpoints. As this representational triad illustrates, representations are social because they are created through communication with others. They are also social because they are shared among members of a group. How might this relate to organ donation? Conceptualized within social representations theory, organ donation becomes more than an individual attitude or a decision. It is a shared understanding, constructed and shaped by the exchange and interaction processes within society. Hence, it is imbued with the values and beliefs that are central or important to that community or society. So the previous work found there were two seemingly contradictory positions in how organ donation was reported. This was through media analysis, tracking back to Dr. Christianard's first transplant, through to Fiona Coote's first transplant in Australia. Focus groups, we looked at how people actually talked about organ donation, and a large-scale scenario where we looked at how people responded to different ways organ donation and transplantation were framed. And what we found was, on the one hand, it was seen as a gift of life. On the other hand, it was associated with the mechanistic removal of organs from the body. For example, in the focus groups, organ donation was often talked about as a yes, but. Yes, I think it's a great idea, but will I really be dead? Organ donation saves lives, but I don't want to be cut up. The thought of him being cut up terrifies me, and I find it distasteful. But if he needed one, I hope somebody would donate their organs. In Australia, organ donation is promoted through the gift of life doctrine as a selfless act of unconditional altruism that benefits someone in medical need and society as a whole. Now, what we found was that the majority of people understand this and agree with these beliefs, but they also hold, at the same time, tacit concerns and fears about organ donation that are not necessarily voiced. So depending on what you ask and in what context, you may get a different response to the organ donation question. If you ask, or if you only ask, are you in favor of organ donation? People often will say it's a good thing, saves lives, helps humanity. However, if you go on further and ask, do you have any concerns about organ donation? You may find that people will start talking about fears about being disfigured, not dead, doctors not trying as hard to save a donor. So how did we draw from this body of research to address the question of how to increase the number of people who register their organ donation decision on the Australian Organ Donor Register? Well, first of all, we drew from research in the United States, and this research had looked at increasing registrations. And we looked at the work in particular of Jason Siegel and Alvaro that had investigated the effectiveness of immediate versus delayed registration. These studies were conducted within the IFF model, and they found that more people signed a donor card when they were given an immediate on-the-spot opportunity to register compared to when they took that donor card home to complete. So our first study focused on the importance of offering an immediate registration, and we contrasted this with a delayed registration opportunity. As you can see, most people registered in the immediate condition compared to the delayed condition. Now, the delayed condition mirrors Australia's current registration system, where registration occurs online at home in people's own time. Now, the results were unequivocal. Significantly more people registered in the immediate compared to the delayed condition. However, what we did was we coupled this with a survey. Now, the survey drew from the theorizing that I've been talking about, and it measured both positive and negative beliefs about organ donation. Now, these were conceptualized as multidimensional, so people were asked to agree or disagree with both positive and negative beliefs about organ donation. Now, on the y-axis is the probability that somebody will register. On the x-axis is the strength of positive beliefs, and these range from 1 through to 7. Now, what we found was those in the immediate condition whose beliefs were weak had a very strong probability of registering. Those in the immediate condition whose beliefs were medium, approximately 4.9 on a 7-point scale, also had quite a strong probability of registering. However, once those beliefs became strong, the negative beliefs became strong, the probability of registering dropped. And you can contrast that now with those in the delayed condition with weak negative beliefs, those in the delayed condition with medium beliefs, and those conditioned in, sorry, that bottom one is the strong condition, and those with medium beliefs. So what this showed us was that registration was more likely to occur if you gave somebody an immediate condition to register in and when the negative beliefs were weak. So this led to the development of the immediate registration opportunity. And this was conducted in collaboration with New South Wales Organ and Tissue Donation Service. So the initiative was aimed at increasing the number of people who register on the AODR. It was for all people, all religions, all cultures, all ages. It involved engaging with the public in face-to-face interactions, discussing concerns and fears about donation, and offering an immediate on-the-spot opportunity to register. Now we go out into the community and we set up our marquee. We approach and we welcome people. We engage and interact with people in a respectful conversation about donation, prompted often through a short survey, and then we offer them an immediate on-the-spot opportunity to register on the AODR. This was actually at the State of Origin, the grand final of the State of Origin at ANZ Stadium in Sydney. It is underpinned by 3 principles: respect, interaction, and immediacy. So the respect, this draws from the theoretical finding that non-medical understandings about organ donation may be quite different, qualitatively different to those held by the medical profession. So sitting at the nexus of life and death, what is often understood about organ donation will always be imbued by social, cultural, and religious values and beliefs. And this often manifests as a yes but. It's a great idea, but will I be dead? It saves lives, but I don't want to be cut up. It's the right thing to do, but will the doctors try as hard to save me? So the positive support that many in Australia will report, this is the yes in the but. Yes, but it is often coupled with some level of unspoken concern or fear. As I said, don't want to be cut up, not being dead, lack of trust, disfigurement, maybe a piece missing, my religion won't allow me to donate, and what will happen to my soul? Importantly, these beliefs need to be respected in their own right and not measured against medical knowledge. These are not within this theoretical framework myths or misperceptions. These are the beliefs that people hold, and they are a function of the society or the community in which they live. So therefore, it is important that people are invited into a respectful dialogue about organ donation, a face-to-face opportunity to discuss beliefs about organ donation, to ask questions, to raise concerns without judgment. What we've found is in these interactions, it is very important to step back from the gift of life doctrine and sentimentalism. Now, this is quite different to many approaches. The research tells us that people are aware and understand that organ donation helps others, that it saves lives. This is not the issue. So what we suggest is that we engage in a non-prophesying dialogue. The conversations need to start where the people are at. We need to build trust and we need to foster understanding. Now, we will often do this by using a very short survey. Now, over the years, we've refined the initial survey that we used in our very, very first study. So it's very short and we can hold it on a clipboard when we talk with people. And it asks people whether they agree or disagree with 12 positive and negative belief statements about organ donation. Now, these statements are in the literature. They were also found in the research that we did with focus groups and also the large scenario study. So this helps people to discuss or to bring up concerns that might have. It gives them license to ask a question. Many people feel quite embarrassed or a little bit silly about asking some of the concerns or discussing some of the concerns that they might have. One of the things that people often say to us is, look, I know I'll be dead, but will I really be dead? And so what they want is they just want that moment in time to talk to somebody about this. And then we can reassure them, we can tell them how brain death is determined. So from our data, we typically get this belief profile. The turquoise bars are those who have not yet registered. The teal bars are those who have registered. So on the left are these very strong positive beliefs that we always find in the community, made up of the gift of life beliefs, helping others, saving lives. This is the institutional discourse. We also have benefits to self, the benefits of donation to the self. Living on makes me feel proud, gives meaning to my life. Now, on the right are the negative beliefs that cluster around the negative consequences associated with donation and the concerns people might have about medical care. Now, you can see there are significant differences in these negative beliefs between those who have not registered and those who have registered. These are really potent, even though they do not seem to be that strong against the y-axis. Even the slightest increase will decrease the probability of registration, and you can see this in the logistical regression here. After we've talked with people and they've completed the survey, we'll ask them if they'd like to register their donation decision on the AODR now. We highlight that they have a choice in how they can register. They can register yes to donate all their organs and tissues. They can register yes to donating some organs and tissue, or they can register a no to donation. We highlight that their decision can be changed at any time. This is not a binding decision. We also highlight that registration alleviates some of the stress for your family because they will not have to make the donation decision for you. And we know that many families just want to honor the wishes of their loved ones. So respect, interaction, and immediacy. Drawing from these principles, we have achieved registration rates between 60 and 90%, which is significantly higher than the national registration rates. The majority of those who are eligible to register do so on the spot. We have been to many different locations. We've been to the corporate headquarters of Qantas. We've been to the grand finals of the NRL or the State of Origin, which are major sporting events in Australia. We've been to local community soccer matches. We've been to a number of different hospitals. We've been to community fairs. And we get the same pattern across these different locations. In the process, we have found a few things. Now, one of the questions we often get asked is about religious beliefs. Now, in Australia, there are over 150 different religious affiliations and 300 ancestries reported. It is really difficult to draw the line between what is a religious belief and what is a cultural belief. People will also come up to us, and one of the first things they may say is, my religion doesn't allow me to donate. Now, we will talk about this. We'll ask them, what they think, and we all sort of draw their attention to the fact that on the Donate Life website, there are position statements by all the major religions offering their support for organ donation. And as you continue on the conversation, you'll find that there are concerns about the body being whole, a need to preserve the body, fear of invasion, maybe discussing death as taboo in their community or in their family. What would my family think? What would my partner think? There is often suspicion and mistrust with institutions in general or the medical profession. They wonder how they will be treated, particularly if English is not their first language. And often there's just a lack of knowledge about what is involved in the process. We found out that you really must go to where the people are. You need to go to their communities, their work, their sporting events, their hospitals, their corporate organizations. And you need to interact with them in their communities. This is how you come into contact with many people who do not go online to register. We've also found out the context in which you ask someone to think about organ donation can affect the salience of those beliefs at that time. This does not mean it changes the content of the belief, just the level of accentuation. If you ask someone to register in a friendly, positive environment, they will be more likely to do so than if you ask them when they are feeling stressed, harassed, or grief-stricken. Now, this has implications for asking people to consider donation in the intensive care unit. We also know that these beliefs are correlated, so that when the positive beliefs go up, the negative consequences go down. And this was illustrated at the grand final of the NRL. Here we have atmosphere and shared mood. As people's shared mood increased, so maybe I should go back a little bit, we set up our marquee in the pre-game precinct at the NRL. So this was from the morning through to the afternoon. There were food stalls, there were clothing stalls, there was dancing, and there was music. And there was a real carnival atmosphere. So as people reported a stronger shared mood, so too did they report stronger gift of life beliefs. As their gift of life beliefs went up, the negative beliefs about organ donation went down. As they went down, the probability of registering increased. Why does it work? We know the donation decision is important. People don't think about organ donation in the course of their everyday life, and they do need to have the time to consider their beliefs, to ask questions, simply just to talk about it. We know respect is so important. We need to respect people's beliefs, whatever they are. We need to understand the intersect between religion and cultural beliefs. We need to interact with them. We need to take a step back and listen. Everybody needs the opportunity to discuss respectfully what they think about organ donation. And these discussions need to start where they are, not where we think they should be. Then we might come in and explain how the process of donation works, what happens in transplantation, how you might register, how you might look if you were in a coffin. We can begin then to start and address these concerns and fears that people hold. We also know that immediacy is really, really important. People need to be given an opportunity to register on the spot. We know that immediate registration helps to counter procrastination, which is often linked to negative concerns. And this has been demonstrated time and time again in the literature. If people are left to register in their own time, it will be left for another day, another time, another place. So thank you for taking the time to listen to this presentation. We are now taking on the challenge of scaling these three principles into an intervention. We realize the work that we have done to date is quite labor intensive, but in the process, we have come to understand the principles that underlie people's registration decision. We are now taking these principles and scaling them into an intervention so that everybody in Australia can become registered. Registration is now more important than ever. Thank you very much for your time.